MSHN Enterprises Training Module 1, Assertive Community Treatment. Assertive Community Treatment, known as ACT, offers the individual highly specialized and personal care every day of the year. Professionals who have a background in social work, nursing, psychiatry, substance abuse, treatment, and case management are available 24 hours a day, 7 days a week for the resident to help in all areas of life. Treatment occurs inside the person's home, or in the case of MSHN, inside of the group home setting, or in the community, offering an unprecedented comfort that many mentally ill individuals do not get in traditional inpatient therapy. The idea is to provide comprehensive treatment for the maximum level of effectiveness. The goal of ACT is to lessen or eliminate the symptoms of mental illness each individual client experiences and to minimize or prevent recurrent acute episodes of the illness, to meet basic needs and enhance quality of life, to improve functioning in adult social and employment roles, to enhance an individual's ability to live independently in his or her own community, and to lessen the family's burden of providing care. The key features of ACT are treatment, rehabilitation, and support services. Treatment occurs in the individual's home, or as I stated before, in the case of MSHN, in a group home setting, or in the local community setting like a park or a library. Treatment is unique to each individual's illness or addiction, and service providers understand that treatment is a lifelong commitment. Rehabilitation. Clients are taught vocational and life skills to help with job placement and employment opportunities. Clients are taught about their illness and work on ways to cope with the difficulties of severe mental disorders. Support services. Families and friends are often impacted in ways we do not recognize or understand. Families are educated on the illness and learn ways to deal with it a little easier. Clients are slowly integrated into society at the level that is comfortable to them. Who benefits? The ACT model is indicated for individuals in their late teens to their elderly years who have a severe and persistent mental illness causing problems and symptoms and impairments that produce stress and major disabilities in adult functioning. For example, employment, self-care, and social and interpersonal relationships. ACT participants usually are people with schizophrenia, other psychotic disorders such as schizoaffective disorder, bipolar disorder, manic depressive illness, those who experience significant disability from other mental illnesses and who are not helped by traditional outpatient models, those who have difficulty getting appointments on their own, as in the traditional model of case management, those who have had bad experiences in the traditional system, or those who have had limited understanding of their need for help. The difference between ACT and traditional care. Individuals with the most severe mental illnesses are typically not served well by the traditional outpatient model that directs residents to various services that they then must navigate on their own. ACT goes to the consumer whenever and wherever needed. Most individuals with severe mental illnesses who are in treatment are involved in case management programs that connects them to services provided by multiple mental health, housing, or rehabilitation agencies or programs in the community. Under this traditional system of care, a person with a mental illness is treated by a group of individual case managers who operate in the context of case management program and have primary responsibility only for their own caseloads. In contrast, the ACT multidisciplinary staff work as a team. The AC team works collaboratively to deliver the majority of treatment, rehabilitation, and support services required by each client to live in the community. A psychiatrist is a member of the team, not a consultant of the team. The consumer is a client of the team and not an individual staff member. How do clients compare with those receiving hospital treatment? ACT clients spend significantly less time in hospitals and more time in independent living situations, have less time unemployed, earn more income from competitive employment, experience more positive social relationships, express greater satisfaction with life, and are less symptomatic. In one study, only 18% of ACT clients were hospitalized the first year, compared to 89% of the non-ACT treatment group. For those ACT clients that were hospitalized, stays were significantly shorter than stays of the non-ACT group. ACT clients also spend more time in the community, resulting in less burden on the family. Additionally, the ACT model has shown a small economic advantage over institutional care.